Dr. Streicher. Your question is, what are the most common symptoms of menopause? I'm going to give you the inside information. Most women know that the so-called change of life is associated with hot flashes, which, while not exactly welcomed, are at least expected. And yet a surprising number of otherwise savvy women are completely unaware of the association between the lack of estrogen and other symptoms. So the list is long. There's vulvar itching and irritation, dry skin, thinning hair, sex becomes painful or actually impossible. And then there's that libido completely gone, and orgasms that are easier to fake than actually experience. And then there's the bladder stuff, like that constant gotta go feeling or recurrent urinary tract infections. Depression, achy joints, and then of course those all night, day, and all day hot flashes. Vaginal dryness, bucket full of lube doesn't even help you. And don't you just love when you can't remember why you walked into the room? So weight gain, that's for some women the most upsetting of all. Muffin top, even if you don't gain weight, you get this redistribution of weight. Anxiety that goes way beyond the state of the world. And then there's those sleepless nights. I could go on. Every woman's menopause is different. And this list, it's not even close to including every possible symptom. So when women come to my menopause clinic, the first thing we have her do is to fill out a questionnaire and put down every single symptom she has. And like this list, the list is always really long. So at the end of that, we always say, okay, what's your most bothersome symptom? If you could only fix one thing, what would it be? And it generally comes down to the big four, starting with hot flashes. 80% of women experience hot flashes. 80% of women want to get rid of their hot flashes. Insomnia, which goes not only with the hot flashes, but just disruption of sleep because of hormonal changes. That occurs in about 60% of women. 60% of women go from sexual pleasure to sexual pain, and it's important for them to fix that not only for their own personal pleasure, but the impact that it has on the relationship. And then weight gain. 90% of women gain at least 5 pounds. So are these symptoms always an indication of menopause? Well, no. And that's actually my challenge as a doctor. When someone comes in with these symptoms, I need to figure out, is your weight gain a consequence of menopause? Is it middle age? Is it a thyroid that's out of whack? And yeah, even hot flashes can be caused by conditions other than menopause. But in general, for a woman who's in her mid to late 40s, early 50s, these symptoms generally are a consequence of menopause. And I know this all sounds pretty depressing. I mean, it actually sounds really depressing, but it doesn't have to be. We're very solution-oriented in our menopause clinic, and there's so many safe, effective options to get rid of these symptoms. And we have both hormonal and non-hormonal options so that no one should experience hot flash hell, sandpaper sex. And honestly, my opinion is that if your doctor has told you that all of these symptoms are a normal part of aging and you should just tough it out, it's time to find a new doctor. So for lots more information, please check out my other videos and articles.